This segment is sponsored by Lansdowne Heights Memory Care, and its focus is to keep residents safe and also healthy in the assisted living community during the pandemic. I spoke to both the medical director and the administrator of the facility. Dr. Pellegrini and Justin, thank you so much for joining us today for Great Day Washington.
Thank you for having us.
Thank you for having us.
I really want to dive into what senior care is, but then even more specific for how I know you break it down. What's the difference between memory care and just regular assisted living?
Sure. So senior living, some people call retirement communities, can be really broken down into 4 product lines: independent living, assisted living, memory care, and then you have skilled nursing. And really based on that individual's needs, they'll enter into a community that's able to meet whatever specific thing that's going on with them.
What about right now, the changes that you have had to make from the day-to-day things that you're doing? How is it different through this pandemic?
So we've here at Lansdowne Heights have made a lot of changes with the pandemic. We're focusing really on socialization for our residents here, but we've been following some local and state guidelines on reopening our community, and have now had to rearrange some furniture in both our dining rooms and our common areas to be able to focus on the social distancing aspect to keep our residents safe. Some other really big changes we've made have been with our staffing. Not only increased staffing, but we focused on daily screening of our team members, as well as twice a month COVID testing to ensure that we have really a baseline. We can make some changes a little bit quicker than we have been in the past. Some of the other changes that we have been focusing on is being able to allow inside and outside visitation from our family members, using some social distancing as well inside of our community. And that's been able to help our family members feel more comfortable coming in, decreasing the likelihood of COVID spreading within the community. And with us being a smaller community, the feedback for us has been tremendous. I mean, you can tell from what our family members have been saying. They're very grateful of being able to not only do those sort of Skype and Zoom calls that I think you've been seeing online, things like that, but now being able to actually see their loved one face to face, having a conversation, seeing how they're doing within the community has really helped with some of the changes that we've been able to make here.
And I would also like to stress upon that we are doing social distancing, not social isolation, because COVID-19 has presented with unique challenges, especially in the dementia care, because few of the residents cannot be confined to their rooms because they could be wandering. So it really gets challenging. So we have done social distancing, taking all the necessary precautions, and we have a strict infection control and prevention policies that are in place, which makes it safer for the resident visitations. That keeping intact, safe the residents and also healthcare professionals' health at this point.
Any recommendations for people who maybe are caring for elderly parents too about the difference between quarantining but then also just self-distancing?
I would say this would be a better time to actually move into dementia care and assisted living in spite of the COVID-19 fears. What I see mostly in the communities, senior citizens who are living independently on their own, they have limited access to medical care, testing for COVID-19. They're isolated and of course they're secluded. And I have seen that, they have difficulty getting their regular clinician appointments, which is making them not to refill their prescriptions or reduce the dosage or either completely stop taking the medication. So we have actually seen a worsening dementia and mobility in Parkinson's and Alzheimer's dementia. In fact, one of the common non-COVID reasons for hospitalization lately is falls that are associated with fractures. So in dementia care, in facilities, we provide continuous physical therapy, which keeps them active and also engage them in small social group activities.
That's excellent.
So,
Yeah.
Yeah, I
To
just
really
want to.
piggyback off of that, I mean, that's a lot of the benefits of being able to move into senior housing community, especially Lansdowne Heights. The programming that we're able to offer 24 hours a day with our activities programming, combats the socialization and the decreases the likelihood of other sort of comorbidities as depression when we're seeing people stay at home. Not only being able to offer 3 nutritious meals a day within the community, having access to care is a huge part just of what the doctor talked about with our 24-hour nursing within the community. So really for me personally, I think acting now, the benefits still outweigh the risk moving into a senior housing community because we're able to decrease the likelihood of those falls when you have the attention to care that you're receiving inside Lansdowne.
Thank you for joining us today.
Thank you so much. We really appreciate you having us on for this segment.
thank you.
And for more information, you can call the number on your screen, which is 703-936-7300, or you can also visit lansdowneheights.com.